Knock, knock, knock. Provide privacy. Wash my hands. Hello, my name is Anna, and I'm going to be the student nurse today. Can you please tell me your full name and date of birth? Check the wristband. Everything matches. Alright, so according to your chart, it looks like we have to change your IV dressing. Have you had this done before?
Yes.
Alrighty, perfect. So do you have any additional questions for me before we start?
No.
Alrighty, I just have to make sure that you aren't allergic to any tapes, alcohol wipes, any chloroplast or anything like that.
No.
Alrighty, wonderful. So I'm going to open up my kit. This is a mask for you that you can put on, and if you can't put on for medical reasons or something, then if you could just turn your head away. I'll open up this and then get my mask. And then wash my hands and put on my gloves. So first what we're going to do is we are going to measure the circumference of your arm. I'm going to go 6 inches above where the catheter and the IV are. And once we get 6 inches, I'm going to go around and then get the measurement, and it should not be more than half an inch greater than what it was last time. If it were, that would indicate infiltration or a possible blood clot or infection, which yours isn't according to your last arm circumference that's documented, so that is good. Next what I'm going to do is I'm going to inspect your IV, making sure that there's no redness, ecchymosis, any edema, any drainage, and then does it hurt if I push on it like this? Is it tender?
No.
Okay, good. So then I am going to remove the old bandage. And I'm going to use this just so that doesn't hurt as bad when we pull it off. Okay, and then I'm going to inspect this dressing and make sure there isn't anything on it, which there isn't, so that can go in the garbage. And then I'm going to inspect the site where the IV is and then make sure that it is not infected, which it does not look so. Next, I am going to, and there is no stabilization device. So now I'm going to remove these gloves and wash my hands and then put on my sterile gloves. My hands are a little sweaty. Okay. Alrighty, and then next we are going to clean off around the IV. in the garbage in a circular motion going outwards. And then I would let that dry, throw it in the garbage. And then I'm going to grab the ChloraPrep and the tweezers to stabilize, and then I would squeeze these two to make the liquid come out. And I could stabilize the IV and then scrub vigorously around, cleaning it for at least 30 seconds. Okay, and then those can go in the garbage, and I would let that dry, and then I would grab the skin prep. And prep the skin. Throw that in the garbage, and I would let that dry. And then we can grab the new one. That in the garbage. Garbage. Okay. And then I would write my initials, the date, and the gauge of the needle. Remove it. And I am going to place it right at the end here. If I didn't place this here, I would use another piece of tape. It's stuck on the glove. To go right down there, because that is the most likely place where it'll start to come up. So that's where you put an extra piece of tape on there. And then per agency protocol, if I needed to change the end cap of the catheter, I could do that right now. So I'd clean up all my supplies, remove my gloves, wash my hands, remove my mask and my patient's mask, and wash my hands again. I would make sure that my patient is comfortable, they're safe, so their bed's down, side rails are up, and they have their call light. And then I could leave the room and document the date, time, and then any assessment findings if I found anything abnormal or anything like that. And then one lifespan consideration would be if my patient could not wear the mask or turn their head, I would get another nurse or someone to assist me. And if they had fragile skin and they were prone to skin tears, I could use a wipe to help get that stickiness off to help prevent skin tears and breakage and damage. That's all.